Welcome to cardiac emergencies and giving CPR and the introduction to this. It's important to note that we'll get back to CPR when we start combining a lot of our skills and putting it together, but this is just your real basic introduction, but it's going to require practice on your end. So let's go ahead and start with a video, and like we had in the previous module, you will have these videos are going to be uploaded, so if there's any sort of lag time, you'll be able to re-watch them if you need them as a reference.
Being able to recognize when a person is having a heart attack can be a life-saving skill. Signs and symptoms of a heart attack vary from person to person and can be different in women than they are in men. Even people who have had a heart attack before may not have the same signs and symptoms with a second heart attack. Chest pain, pressure, and discomfort are the classic signs of a heart attack. The pain can range from mild to unbearable. The person might describe the pain as tightening, squeezing, or severe pressure. The pain may last longer than 3 to 5 minutes or go away and then come back. Although the pain may feel similar to that of a muscle spasm or indigestion, resting or taking medication does not relieve the pain. The pain may spread to one or both arms, the back, the upper part of the stomach, or the neck and jaw. The person's appearance and behavior may also offer clues. The person's skin may look pale or slightly grayish or bluish, and the person may be sweating heavily. The person may be having trouble breathing and feel short of breath. Some people become dizzy or lightheaded, or feel nauseous or vomit. Others may become unresponsive. Many people who have had a heart attack say that they felt anxious, like something really bad was happening. Others describe feeling unusually tired for a period of time leading up to the heart attack. Trust your instincts and seek advanced medical care immediately when you recognize the signs and symptoms of a heart attack.
So what are the signs and symptoms of a heart attack? Because we need to be able to recognize this. In fact, this is the most likely the reason why you would have to perform some sort of CPR on someone would become because of some sort of heart failure. So signs and symptoms, as discussed in the video: chest pain, discomfort, pressure, or squeezing that lasts longer than 3 to 5 minutes. So this is the important piece here, is it's not the sharp, quick feeling of pain that goes away. There is no relief in any sort of changing of position or taking of any sort of medication like aspirin or anything like that. And it goes away and then comes back. So it's this continuous issue. A lot of times the discomfort spreads from one to or both arms, the back, shoulders, neck, and jaw, part of the stomach. When I was 13 years old, I actually witnessed my grandmother have a heart attack, and you can see the discomfort on someone's face. A lot of times there's quite a bit of sweating, and you can tell by them grabbing their chest that they're in that discomfort. So it's good to assume that and get them help rather than assuming that it's not a heart attack. So additional signs and symptoms: so dizziness, lightheaded, trouble breathing, any sort of noisy breathing, shortness of breath or an accelerated breath, faster than normal breath, nausea and vomiting. Like I said, you can tell someone is having a heart attack because you will see the color of their skin change. They'll be sweating. They have that anxiety and that anxious feeling. They have extreme fatigue, and under severe heart attacks, you'll see this unresponsive patient. People may experience these differently. In fact, not everyone has every sign and symptom. Some people feel a sense of tightness. They go in and they are told that they had a heart attack and it was mild, and they didn't realize that it was as bad as a heart attack. It just felt like that tightness in their chest. Okay. People who have a heart attack before may not experience the same symptoms the second time. Okay, so anytime that you have any sort of suspicious heart issues, make sure to call EMS. So when we hear about those classic signs, so is your left arm numb? That's going to be a classic sign of a heart attack, what we see in the movies, and that's a lot more likely in men than women. Women experience a much milder chest pain. In fact, most women don't even seek help when they're having a heart attack because they don't realize that they're having one. So shortness of breath, nausea, vomiting, extreme fatigue, dizziness, lightheadedness. If you're seeing any of those symptoms, or especially more than one of those symptoms, make sure to seek help. If you suspect a heart attack, you call 911 first and foremost, because even if you can give CPR, an AED and emergency personnel is going to be the best chance of survival that this person has. Okay, be prepared to give this CPR and an AED as soon as someone becomes unresponsive. We don't want to do any sort of CPR if someone is responsive, because that means their heart is actually working, right? It's circulating and doing what it's supposed to do. It's if someone is unresponsive and doesn't have a pulse that we would give CPR. Make sure to get them in a comfortable position and keep them alert and asking questions as long as you can until EMS arrives. So, offer to get them any prescription that they might take. This is very important. In the front country, this is one of the differences between services that you can provide. In the front country, you cannot give anyone medication that's not theirs. You cannot give them the medication. All you can do is hand them medication that is theirs and allow them to take it themselves. Okay? There's a good chance that people have had a heart attack or heart issues before they're having a heart attack and will know what they need to do to set themselves up for success. Reassure the person and monitor their condition and hope that that's as far as it goes. There's a difference between cardiac arrest and the cardiac chain. Cardiac arrest, heart attack. A heart attack is when the heart isn't functioning properly. Cardiac arrest is when the heart actually stops beating. This is typically when someone becomes unresponsive. Their heart is no longer functioning inadequately. It's not functioning at all, okay? So cardiac arrest frequently happens suddenly and without any sign or symptoms. So what is the chain of command for cardiac arrest? It's going to be the causes of cardiac arrest are going to be any sort of cardiovascular disease, any sort of severe trauma, a breathing emergency such as a drowning incident or a near drowning incident, okay? Electric shock of some sort and any sort of drug overdose are going to be the most are going to be causes for cardiac arrest, so that actual stopping of the heart, okay? In children and infants, the most common cause is breathing emergencies and any sort of long-term heart issues that child may have. Okay, so although a heart attack can lead to cardiac arrest, the symptoms are different. So make sure that you know the difference between the two. A cardiac arrest is when the heart actually stops versus a heart attack is when the heart is not functioning the way that it is supposed to. A person in cardiac arrest is not responsive and not breathing, okay, and does not have a heartbeat. At this point is when we would assess whether or not to give CPR, okay, and if we're in a place to do that, if it's safe and we can do that. And the reason for that is, again, if someone is having a heart attack, their heart is still functioning. There is still blood flowing. They are conscious, okay? But if they become unresponsive and you cannot feel a pulse, then they are in cardiac arrest and we need to start looking into CPR. So here's a video demonstrating the chain of the cardiac chain.
When a person is in cardiac arrest, quick action is crucial. The cardiac chain of survival describes 5 actions that, when taken, increase a person's likelihood of surviving cardiac arrest. You have a major role in completing the first 3 actions. The first link in the cardiac chain of survival for adults is recognition of cardiac arrest and activation of the Emergency Medical Services (EMS) system. The sooner you recognize that a person is in cardiac arrest and call 911 or the designated emergency number, the sooner advanced medical personnel will arrive. Early CPR is the second link. CPR helps to circulate oxygen-containing blood to the brain and other vital organs, helping to prevent brain damage and death. The third link is early defibrillation. The electrical shock delivered by an AED may restore an effective heart rhythm, significantly increasing the person's chances for survival. The fourth link is early advanced life support, which is provided by EMS personnel at the scene and on the way to the hospital. Integrated post-cardiac arrest care is the final link. After the person is resuscitated, an interdisciplinary team of medical professionals works to stabilize the person's medical condition, minimize complications, and diagnose and treat the underlying cause of the cardiac arrest. 4 out of every 5 cardiac arrests in the United States occur outside of the hospital. When you complete the first 3 links in the cardiac chain of survival, recognizing cardiac arrest and activating the EMS system, immediately beginning CPR, and using an AED as soon as possible, you can make the difference between life and death for a person in cardiac arrest.
So it's important to note that the human body has about 7 minutes of oxygen in it at all time. And obviously this isn't ideal, but at least something to keep our primary organs functioning. So by you performing, if you don't have an AED, and you performing chest compressions, it will help to continue to circulate the oxygen that's in someone's blood. Obviously, this isn't as good as what you and I and our lungs and heart are doing right now, but it is something to give them the best chance of survival. We're gonna have a whole section on AED, when to use that, how to use that, and so we'll move forward with the AED later, okay? Let's go ahead and look at what CPR looks like.
Hey, are you okay?
After confirming that someone is unresponsive and not breathing or only gasping, assume cardiac arrest and begin CPR.
He's unresponsive. Go.
Ensure the person is on his back on a firm, flat surface such as the ground. Next, kneel beside him and place the heel of one hand in the center of his chest, with your other hand on top. Interlace your fingers and make sure they are up off the chest. Position your body so that your shoulders are directly over your hands. With this technique, you can use your body weight to help compress the chest. Now, give 30 chest compressions. Keeping your arms straight, push down at least 2 inches, then let the chest return to its normal position. Continue to push hard and fast, giving compressions at a rate of between 100 and 120 compressions per minute. Next, give 2 rescue breaths. First, place a breathing barrier over the person's nose and mouth. Then, open the airway by putting one hand on the forehead and 2 fingers on the bony part of the chin and tilting the head back to a pass-neutral position. Pinch the nose shut, take a normal breath, and make a complete seal over the person's mouth with your mouth. Blow for about 1 second while looking to see that the chest rises. Take another breath, make a seal, and give a second rescue breath. Continue giving sets of 30 chest compressions and 2 rescue breaths until you notice an obvious sign of life. An AED is ready to use and no other trained responders are available. You have performed 5 sets of CPR and another trained responder is available to switch. EMS personnel take over. You are alone and too tired to continue, or the scene becomes unsafe.
Make sure to watch this video again before your quiz, as it has a lot of the key information from this topic in it. Again, this video will be in the module, so you're able to watch it without watching this entire lecture. After this, go ahead and move on to practice at home. Okay, so again, we're not doing the full assessment, we're just practicing CPR at this point and learning that skill. There's a whole assignment for practicing at home where you create your own mannequin and you use a cup as a as the mouth of the mannequin, and you breathe into that by tilting the cup, and it's going to walk you through. There's a whole video that you follow along and practice this skill. You'll need to upload that video to me so that way I can see your skills and give you feedback.